Cuba's universal health care has long been a model for other developing countries. Since 1963, thousands of Cuban doctors and nurses have participated in outreach programs, bringing hands-on care to people in Asia, Africa, and the Americas. Cuba has also made advances in research and disease. In June, the World Health Organization declared Cuba the first country to eliminate the transmission of HIV and syphilis from mother to child. We begin with this report from CCTV's Michael Voss in Havana.
An early morning Tai Chi class in Havana. All over the country, elderly Cubans are encouraged to participate in daily exercise routines. It's one of the factors, they believe, that's helped make life expectancy here higher than almost anywhere else in Latin America. Exercise classes like these are part of Cuba's emphasis on preventative medicine. With very limited resources, they've developed a free healthcare system that's producing impressive results. According to the latest World Health Organization statistics, infant mortality rates in Cuba are lower than the United States, while rigorous vaccination programs have eliminated diseases like polio, diphtheria, measles and whooping cough. Everyone has access to free healthcare, but with Cuba's struggling economy, there's been little money available in recent years for new equipment, renovations and repairs. Drugs can also be hard to come by. Today, Cuba spends 8.8% of GDP on healthcare, though in dollar terms, that's a modest amount. Sergio Bermudez is Deputy Director of Havana's Almejera Hospital, one of the largest medical facilities in the country.
Preventing simple illnesses is an efficient way to improve people's health. Our plan was to concentrate on eradicating preventable chronic diseases, and today these are no longer a major cause of death among the population.
From the very beginning, Fidel Castro pledged to make universal access to healthcare and education central themes of the revolution. Yet almost half the island's 6,000 doctors were amongst those who left the country for ideological reasons and headed to places like Miami. Training more doctors became a priority, and from just one medical school on the island in 1959, there are now 24 faculties of medicine. Today, this island of 11 million people has about 70,000 doctors, more, it claims, than the whole of Africa. So many, in fact, that it started to export doctors to other countries. According to Cuba's Ministry of Health, there are currently about 50,000 health workers employed in 65 countries around the world. Medical assistance is also at the heart of Cuba's soft diplomacy.
You could call this medical diplomacy, a revolutionary medical diplomacy which isn't about individual monetary gain. Over the years, people in the Americas, individuals and governments have come to understand and respect the principles of our country.
One of the main programs is called Operation Miracle, Eye Care for the Needy. It's a joint project with Venezuela, which claims to have treated almost 3 million people since it began in 2004. Some have flown to this Havana hospital for surgery, while Cuban specialists have also set up eye clinics across Latin America, Africa and Asia. For a country that has spent more than 50 years trying to ensure that it didn't become isolated by the US trade embargo, this is one way of using health aid to help win hearts and minds.